a discussion session. So I am happy. Uh, it is an encouraging session. So I want all of the participants to please interact in all the aspects through your chat box or directly you can interact in the series. Okay. So we are moving forward. So this is a voyage through a series of questions or answers. Basically, questions and answers are related with this presentation. It's an interactive session. The beginners or the Ayurveda graduates who are just parts out can interact, no problem. And senior doctors, I think so many senior teachers and doctors are there in the session. You can also share your experience and suggestions. Why? Because knowledge sharing is an important part. Okay, and I am dedicating this session to Dr. P.M. Madhusar, Associate Professor, Department of Roganidana Kannur, and Dr. Sheila S., Professor, Department of Sastavrita, Government Direct College, Trivandrum, and Dr. L. Mahadevan, sir, for giving me these ideas, clinical ideas in my journey, clinical journey, OPD. Okay, and it is blend of takeaway messages and creative questions are there to think about the concepts of Ayurveda. Okay, so shall we move forward? You will be with me in the session. Okay, so from first, these are the about the presentation. We will have a look on the skin, talk examination of the skin lesions and different cases. It is basically a case-based discussion only. Psoriasis, fungal infection, dermatitis, eczema, warts, acne, urticaria, tumors. Okay, it is divided into two parts. Today we are covering the first part only and also with the Patyapatya. Okay. So before starting, I want answers. Okay. I'm telling directly that it is an interactive session. So I want answers in the chat box itself. So my first question is whether Ayurveda can treat skin disease at OPD level. Yes or no? Only two answers, yes or no. Definitely yes. A big yes. Okay, thank you. Second question, whether Shodhana is needed in each phase of treatment of skin diseases. Whether the answer is yes or no. Whether Shodhana is needed. I am expecting an answer no, mostly rather than yes. Yes, okay. So many are okay with me. Thank you. The third question, which is the Vajrayuda or the most important medicine of an Ayurvedic doctor in treating a skin disease, whether it is a Kashaya or a external medication like any other thing, or any Arogyavardhini, anything like that, a Kashaya or an Arishta or a Guliga like a Shorogugulu or a single drug. What is your option? So many options are coming. Mahamanjishta, the Kashaya. So my basic option is whether it is a Pradama Kalpana, secondary Kalpana or tertiary Kalpana. Means, and among the Pradama Kalpana, which is that? Kashaya, Churna, Guliga, or any external medication like ointments or like that. That's my next question. Okay. Okay. So according to, I will give my answer. We can discuss through the session. My answer is the best Vajrayuda of an Ayurvedic doctor according to my experience. Okay, I'm telling on the basis of my experience, it is Kashaya itself. For whatever condition, basically for me, according to my experience, the best medicine is a Kashaya. Okay, I will tell in my class itself. So next question, whether external medication or internal medication is more beneficial in treating skin disease through Ayurveda. What is your answer? Internal, both. Internal. Okay, internal, both. Okay, I am asking in among these both, whether internal or external. I want a perfect answer. Which is more beneficial? That's the question. Okay, internal. Okay, good. The correct answer. Okay. All these questions and answers are on my based on my experience. The seniors can also, of course, you can discuss or you can add on your points. Okay. The next question: why mercurial preparations are more used? I think you are knowing most of the mercurial preparations are used in as ointments or external preparations for treating skin diseases. Why? Have you checked it? Easy. Okay. Because of minuteness. Okay. Yoga Vahi property, fast acting. Okay. Rather than that, how many of you have thought about this question? Okay. How many of you have thought about this question? I didn't expect. Okay. So you want to expect, you want to ask all these questions. Okay. I am challenging. Okay. I will tell. Okay. We can move forward. There are some more questions like this. We can have discussion on all these questions. Okay. So according to me, It is only one principle because of the presence of sulfur. And sulfur is the best antidote of mercury. And you are not knowing that the best skin-friendly medicine is okay. Okay, your properties are there. Yoga Vahi, fast effect, everything is there. You are knowing most of the preparation, Gandhaka Rasayan or anything. Okay, starting from Malaharam itself. Okay, sulfur is there with. Okay, that's the main. Okay, can move forward. So whether same medicine can be given. So okay, here we are discussing the cases that I have treated. Okay, so I am asking, I am giving an idea. So whether the same medicine can be given to all the patients having the same skin diseases. For example, you are getting the same patient like psoriasis, or giving the same patient like Dadru, or any other case. No. Okay. Good answer. This is the best question and the best answer. Prakriti is important. Prakriti or Vikriti is important. One question is there from you. That's why I'm asking the next question. Whether Prakriti or Vikriti is important in a disease. It depends on Prakriti. Both. Okay, we can discuss. We can discuss. Okay. Clear? Prakriti. Okay. For me, the answer is no. The same medicine cannot be given to all the patients having the same skin disease. Okay. A skin disease psoriatic patient, okay, of Dr. Aravind, if I am a psoriatic patient, my treatment is different. And any other person, for example, Dr. Rahul, if he is having psoriasis, his treatment is different. Okay, I will discuss that question directly in this class itself. Okay. I think you are getting with the class. Okay, we can move forward. So next, whether diet has a role in prevention and treatment of skin disease? Yes or no? Whether diet has a role in? Yes. What is the role? In which disease it is having more role? Among the skin diseases, in which disease it is having more role? Can you name some of the diseases? Kusta, okay. Psoriasis, okay. Shida Pitta, okay. Okay, we can move forward. Clear? Yes, diet has a good role, very big role in the treatment of psoriasis. Okay. These are just introduction questions. Okay, don't think that these are the final questions. Next question. I think you're all knowing. Okay, I'm not getting into the basics. Why Kushta is so called? Why Kushta is so called? Anyone? Okay, not the definition. I want the answer, meaning. Okay, looking ugly. Kushnadi Tadvabu. Okay, what is the meaning? I want the English meaning. Okay, I think now we are dealing. First of all, I want to tell now we are living in a world which is fast moving, which is mobile addicted. So everything should be based on the concepts. If we want to express to the modern people, to the youngsters, what is the reason? Kushnadi Tadvabu. What is the answer? Discoloration. Okay, the correct meaning? It is basically cracking of skin or the skin texture is lost. Kushnadi Tadvabu Idikishtam, which means the texture, the skin has a texture which is lost. Hence, it is called Kushta. Okay, clear. Okay. So, what is the difference between Kushta and Kshudra Roga? I think you are knowing Padadari. It is a Kshudra Roga. You are knowing Dadru. It is a Kushta, isn't it? You are knowing any other disease. For example, Punaga. It is a Kshudra Roga. So, what is the basic difference between Kushta and Kshudra Roga? I'm not asking about Kushta is of two types. Okay, Mahakushta and Kshudra Kushta. I am asking about Shudra Roga, not Shudra Kushta. Okay, which is more? Anyone is thinking about this question? Yes or no? Which one we are getting more, Kushta or Kshudra Roga? Which one is getting more in your clinics? Kushta or Kshudra Roga? More Kushta or Doshaja. Okay. Okay. Kshudra rogas are easily treatable. I will ask. Okay, everything is coming in these slides. Okay, we can discuss. This is a question for discussion. We can get the answer after the class, I think. Okay, so you are with me, I think. So we can move forward. Okay, you are with me or not? So like this, you want to give answers. I will be asking questions directly, and I will give on my opinion also. Okay. So I want an interactive session, directly interactive session. It is an online session. Furby, I am asking for an interaction, direct interaction. Okay. So why this subject? First of all, why? Why a TwakVeda class? Everything. Okay, you are knowing that even in the times of COVID-19, Ayurveda is everyone is telling that it is not a correct thing, but everyone is telling that it is not apt for emerging disease like Nipah or COVID-19, like that, isn't it or not? Whether you are agreeing or not, the first point. Okay, Ayurveda is not uh, you're agreeing or you are disagreeing. Not at for emerging disease or not. Okay, I'm asking the first. Okay, it is apt. It's correct answer. Whether all the students, I think most of some of your teachers or your all are your all the students, all the participants here are some one are students previously. So what my next question? Ayurveda students are more interested in teaching career than clinical career. What is your opinion? Yes or no? Mostly. I'm telling mostly. Yes. Okay. How many of you are interested in clinical? Please raise their hands. This class is for them, basically. Okay. Others also can, no problem, but I am telling that. Okay. Wider concept instead of simple understanding, whether it is correct or not. We are having wider concept instead of simple understanding. Yes or no? Yes, whether you are having wider concept or simple concept. I will ask a simple question. I will ask a simple question. What is the meaning of the word Abba Bahuga? I'm just asking. Everyone is telling wider concept. What is the simple meaning of the word Abba Bahuga? Anyone? In that word meaning, what is the meaning of the word up and what is the meaning of the word Bahu? Then you can get it. I think everyone has seen Bahubali film, isn't it or not? What is the meaning of the word Bahu? Hand, isn't it? What is the meaning of the word up? What is Apana? Up, Avani, up means downwards. Up means downwards. Okay, downwards. Apana is the Vada which is going downwards. It is called Apana. Udu means upwards. The Vada which is moving in the upward direction, which is causing Chardi. Everything is called Udana. Up is moving downwards. Okay, the Vada which is moving downwards, which causes the expulsion of fetus, flatus, urine, and fecus. Apana. Now the meaning, Abba Bahuga. Simple. Bahu in downward direction. Unable to lift the hand. Clear? I am not asking the English meaning. Clear or not? I'm just giving an idea. Clear or not? Abba means downwards. Bahu means hand. The hand which is in the downward direction means unable to lift the hand. That's the meaning of the word Abba Bahuka. Basically, everything is having a meaning. I will ask. I will ask regarding skin itself. I think we can move forward. Okay. This is simple understanding. Okay. What is one more thing? What is called? Can you explain Gurutva? What is Gurutva? What is Gurutva? Okay. Can you name anything in Ayurveda regarding Gurutva? I think you have studied. But you are not studying like that. That's all. I will give the answer. One word. In Ayurveda, it is having a one word. You have studied it. Gurutva. Gurutva. What is Gurutva? The guna, Gurutva. Adi Padana Asamavai Karanam Gurutvam. You have studied. You have studied. Adi Padana. Padana means that which is coming down. Adi Padana Asamavai Karanam. The Karana which is responsible for a object to be coming down. It is called Gurutva. It is nothing other than acceleration due to gravity. Padartha Vijnana is nothing other than matter physics. I think it is clear. Yes or no? This I'm just telling an example for this. We are going with skin. Clear? Everything in the textbook is having some meaning. We will tell. So next one, hidden truth. Okay, we are having professionalism, lack of professionalism. Yes or no? How many of you are wearing coat every day in your clinics? Lack of unified textbooks. Whether you're have you seen a unified textbook in Tokroga? Have anyone? Can you give a name of an unified textbook in Tokroga? Yes or no? Yes, there is a book. Okay. Please refer it. CRS have published Tokroga regarding skin diseases. Okay. It is not a complete book. You can. And Dr. Mahadevan sir's book is very good regarding Tokroga. Okay. I'm giving two references. First one is CCRS is having a good book. And Mahadevan sir's 2 volume of dermatology is very good. Clear? And syllabus have modern concept, but students are you are having updated knowledge. I think you are having research outlook. Okay, how many of you are documenting? How many of you have published your cases? Okay, your task one is this symbol. Okay, everyone, I think you are having so many cases, good cases with you. Please document. Skin disease is very easy to document. Please publish your cases. Okay, as a case report. Very simple. Please publish it. Okay. How many of you will try? If you want any help from my own side, I will give. So we are starting our discussion. Shall we? Okay. So first case, a 62-year-old normosthenic female patient. Please listen. Blackish skin lesions with severe itching present over the soles for 2 years. Okay, if this patient is coming to me after 2 years, blackish skin lesions are there, unable to walk due to severe pain. She can't even wear the chapel. Okay, and was taking allopathic treatment for the last 1.5 years, but only symptomatic relief was there. Okay, and this is the case. It is I was treating this case in 2018. So my question: how will you assess this patient? Whether it is a skin disease or not? What are the things that you will check? This patient is coming to you. I am that patient. Please consider that I am the patient. I am a 62-year-old neurasthenic patient. I am having this skin lesion in my leg. Okay, it is very painful. I can't even wear my chapel. Okay, I am unable to walk due to this. Okay, you are directly going with Vibhadika. Okay, good, good. So you are not checking any other thing. What are the things that you should check? Okay, what type of lesion? Okay, yes, what is the reference of the work? Wards. Okay, options are there coming. Wards, primary lesion or secondary lesion. Okay, exposure. Okay, very good. One good question. Exposure. What are the other questions that you should ask? Which footwear she used? Very good. What are the ahara vihara? Okay, okay, good. I think you are knowing, but everyone want to answer question each and every question in an order. That's the important thing in a skin disease. Okay, I will tell. That's the first message that I want to give. Assessment of the patient. Okay, so there are some messages during this class. The first message is assessment of the patient. How will you assess this case? How will you assess this case? Anyone? How will you assess a patient, whether that patient is an original patient or not? How will you assess? This is skin, okay, no problem. Some patients are coming to you in a government hospital sometimes, and they are telling they are having abdominal pain here, there, pain there, like that. Well, how will you assess it is an original patient or not? Dashavit Pariksha. So according to me, I will tell. So will you do the Ayurvedic assessment of a skin patient? That's the question. Now you can answer. Prashna Pariksha, okay, sensory loss, taking detailed history. What are the things that you should ask? Okay, I am explaining on this is my concept, okay, that I have got from my senior teachers, okay. Assessment of Arogya, first of all, assessment of Dosha, assessment of Avastha, and at last, assessment of Roga. And here also, the thing basically it is Tok. So the last one is assessment of Tok. Clear? Clear or not? How will you assess Arogya? You are knowing, everyone is knowing that question. How many of you are asking this question? Don't ask this loga. Anna Bilasho Bhuktasya Parivaga Sugenacha. So whenever a patient is coming to me, my first question is whether bhuk lagta hai, whether you are having good appetite, whether your sleep is okay, whether your bowel is okay, whether your urine is okay, you're getting or not. Not BAMS, it is from modern you have copied BAMS. From this loga you want to ask. Clear or not? This is the first question. That's important of this loga. Not our, there are so many other questions. I'm just asking. Basically, you want to ask these four questions. I will tell what is important in coming slides. Okay, clear or not? At least these four questions. Whether book लगता है आपको means whether you I am little bit Hindi is coming. Sorry from my own side. So whether you what are your foods? Okay, what foods you are taking? At which time you are taking? Okay, and what is your bubble? How about your bubble? Everything you want to ask. Clear or not? Next, how will you assess dosha? What is dosha? Anyone? Assessment of dosha. How will you assess dosha? What is dosha? Anyone? Here also, we have studied so many slokas, isn't it? What is basically dosha? Anyone? Guna based. Yes, correct answer. Guna based means can you observe it? Can you see it? How you can explain it? Okay, doshana sabhava dosha idi. Please listen. Please listen. I am just against that. How a science can exist with a negative reasoning? Please explain. Dushna sabhava dosha. Dushna, it is a negative part. How our Ayurveda can exist with a negative part? Okay, you're getting or not? It is a negative thing. Positive bata do. Please tell the positives of dosha. How you can assess dosha? Rajana. No, not Sharira Rajana. I think everyone. What is Samadosha? Anyone? What is Samadosha? I will slides. I am not moving it. It will be coming. What is Samadosha? Everyone has studied. Samadosha, Samagnisha, Samadhadu. What is the word meaning Sama? Balanced. In Ayurveda, I am asking in Ayurveda, not modern. Can you explain Samadha of Vada? Can you explain Samadha of Vada? Equilibrium, okay, it is okay. That's the answer. Pragrita karma of dosha. Please listen. Sama dosha. Sama so karmam kuruvade. Sama means it is written in Ashtanga Hridaya itself. No one has, I think, they are. Please check it. In Doshadadu Mala Vijnani Adhyaya, it is like explained. Sama so karmam kuruvade means dosha can be assessed through. What is the meaning of the dosha? Okay. Pravartanam dosha lakshanam. Pravartana lakshanaha doshaha. This is a sloga from my guru. Okay. That which I admire more. Vaidibhushanam Raghavan Tirmalpada. He has written a Malayalam commentary, Pragashika commentary on Ashtanga Sangraha. Okay. And in that book, in Doshadada Malavijnan, it is explained Pravartana lakshanaha doshaha. Dosha can be assessed by lakshanas. And how samadosha can be assessed, samavada can be assessed? Nothing. Tam uchvasa nishvasa. You have studied. Whenever there is problem in uchvasam, okay, nishvasam means expiration, inspiration. If it is okay, vada is okay. One example. If it is problematic, vada is problematic. You are getting or not? Pitta, Pakti, Ushma, you have studied. Whenever there is problem in Agni, which dosha is affected? Pitta. Clear. Which organ is affected? Whenever there is problem in digestion, which organ is bhook nahi lagta? Liver. That's the answer. That's the answer. Liver. Clear. Like that. That's why what is the importance? You have studied everything in anatomy and in physiology, but little bit understanding. Okay. Then we can move forward, I think. From this, you want to assess whether doshas, which are the doshas that are there. From the question, okay, assessment of Tok, it is different. And he has studied the concept of Arthavadushti. This is the important sloga that you want to learn or study. Okay. Whenever there is kunaba, you are getting something fishy smell is there. Rekta is involved. Whenever there is grandhi, padakaba is involved. Whenever there is puya, pas, rekta pitta is involved. You're getting? Whenever there is dryness, vada pitta is involved. Clear or not? I think you're getting that point. Clear? Clear or not? This one you want to assess. Okay. So then we can move forward. And avastha. Avastha means whether it is ama avastha, pakka avastha, or pachimana avastha. Clear? This avastha is also important. Whether ama is there, you want to clear the ama and you want to give the medicine. Otherwise, all these concepts are not for sutra or not for sloga or not for samhita padan. It's for practically useful in the clinics. Okay, please go with that. Clear or not? And the last, roga. Roga ka assessment, you are knowing the assessment of roga. Dushyam, desham, balam, kalam, analam. Please ask and please write it. It is very much important, I will tell. Okay, prakriti, vaya, sattva, satmya. Okay, what is the importance of this Dashavida Pariksha? I will explain. Okay, in the coming slides. So, assessment of TOC. How many of you are assessing TOC seriously in skin disease? Main assessment, okay, assessment of Yoga. Okay, we have discussed. Okay, assessment of Arugya, assessment of Dosha, assessment of Avastha, assessment of Roga. And last one, our disease is basically skin disease, isn't it? So, we want to assess the skin itself, the integumentary system. Why it is called integumentary? Anyone? Why it is called integumentary? What is the meaning integumentary? Protective covering. That's all. Integument means protective covering. That's all. That's the meaning. That's why hair, skin, everything is coming under integumentary. I think you are knowing the functions. I'm not going with this. Okay. But it is basically divided into dermis, epidermis, and subcutaneous layers. You are knowing all these things, I think, and the functions. Whether I want to explain or not. The details of the anatomy and physiology, I think a little bit you are knowing. From this slide, I will share this slide. Protection, regulation, self-maintenance. Okay. So this is the thing. Epidermis, dermis, and hypodermis. I think you are knowing. Basically, integumentary system consists of skin, hair, nails, everything. Okay. That's why Kunaga is also included. Okay. Clear? So we can move forward, I think. So, which are the layers of the skin? I think everyone is knowing. Which are the layers of the skin? Epidermis, dermis, and hypodermis. Okay. So my question is, you are knowing that hyperkeratosis. You are knowing that hyperkeratosis, isn't it or not? Okay. So it is more common in hyperkeratosis is more common in which area of our body? Hyperkeratosis is more common in which area of your body, not scalp. I am asking in which part of our body? Foot, neck. It's not neck, it's soles, palms and soles. Why? Can anyone answer? Why? Have you checked about this question in during your studies in BMS? Why it is more common in palms and soles? Pressure, thick skin. Why thick skin? Why thick skin? This is the answer. The next slide will give the answer for you. Okay, please give. Okay, you are knowing stratum corneum, the outer layer, thick and outermost squamous layer, having dead keratinocytes, isn't it? The second thing is the answer for you, stratum lucidum, which is only present in palms and soles. Clear or not? Clear, and it is comprising of elidin, keratin, and lipids. That's why it is having a waterproof, and more pressure is there, and more keratin production is there due to the presence of the stratum lucidum. Hence, it is more common in palms and soles. Clear? I think now it's clear for you. I think granulosum you are knowing. I'm not explaining. It is containing of keratinocytes and stratum spinosum, melanocytes are there, and stratum basale. Okay, these are the 5 layers of epidermis. Shall I move forward? I am not giving anything regarding. Okay, you are knowing that. Okay, the cells, I think. So we can move forward. Okay. So next layer, dermis. You are knowing it is divided into papillary and reticular. What is the importance of papillary? Pexinin and mesial copper cells are there, which are helpful for sensation. Okay. And in reticular layer, pilosebaceous unit is there, hair follicle is there, erector pili muscles, which is causing goosebumps. You are knowing. What is the importance of armpit and groin area? Why this pruritus is more common in armpits and groin area? Anyone? Most of the patients are coming to and asking about they are having more sweating or more pruritus in these areas. Why? Why? Sebaceous gland. No, what is the difference between sebaceous and sweat glands? More apocrine sweat glands are there. Apocrine and eccrine, though 2 types of sweat glands are there, and hairy skin. Okay, armpits and groin area are having hairy skin in all females and males. Grown for males and females. You are getting? And due to the apocrine sweat gland. What is the importance of sweat gland? What is the importance of sweat gland in our body? Body temperature regulation. Okay, body temperature regulation. What is the importance of sebaceous gland? What is the importance of sebaceous gland? Okay, clear. That's the same. Okay, I think whether I want to explain this, yes or no. We can move forward or not. Directly go to the keys. Okay, explain. Okay. And the hypodermis, the third layer. It is not originally the part of the skin, but for Ayurveda, it is important. It is called subcutaneous or subcutis or hypodermis layer. It is a communicating layer, loose connective tissue, fat cells. Okay. So my question is, what are the layers of skin according to Ayurveda? You are knowing, isn't it? Yes. Okay. You are knowing Abhabasini, Lohita, Shveda, Tamra, Vedhini, Rohini, Mamsadara. So there is a classification, a correlation like this. Okay. So my question is, you can correlate with stratum corneum, Lohida with stratum lucidum, Shveda with stratum granulosum, Tamra with the 2 layers of last 2 layers of epidermis, Vedhini with papillary layer and reticulum. My question is, why Abhavasana is so called? Why? Anyone? Why it is so called? How many of you have checked? Okay. Sarvam Varna Abhavasedi. What is Sarvam Varna Abhavasedi? What is Baswara? Who is Baswara? Who is Baswara? That's the answer. Who is Baswara? Who is Baswara? Surya. Bhaskara, Surya, Bhaswara, okay, Hababhasini, that reflects light of the sun. That's the answer. That's why you have studied Chaya in Indrasthana. All these are having connections. Ruba, Chaya, all these are having connections. Okay. Avabhasana is so called. Why? Because it reflects light from the sun. It is having the layer which is directly in exposure to the sun, hence called Avabhasani. Clear? Chaya Prabha. Why Mamsadara is so called? The same meaning. Why Mamsadara is so called? I've explained a little bit earlier. This then, Mamsadara, the layer which is over the muscles. Clear? Subcutaneous tissue, the hypodermis. Ayurveda is considering the hypodermis also. It is not holding mamsa, it is dara. Dara means it is covering above the muscle. It is not holding the muscle, it is above the muscle. Means the hypodermis, which is having adipose tissue and all those things. Why it is called Vedini? Why it is called Vedini? Anyone? Why it is called Vedini? The same meaning, pain sensation. Why? Why? Succinate and mesocorp, vibratory sensation. Okay, sensation is there. Hence, it is called Vedini. Vedana means sensation, not pain. It is not pain, sensation. Vedana is of two types. You are knowing Pratigula Vedana and Anugula Vedana. I think you have studied everything. Okay, the sensation. Clear or not? So, how many of you are checking this diagnosis of skin? How many of you have checked it? Whether you are knowing the skin lesions or not? So, first of all, regarding the history, okay, you want to check the time and site of onset, the course, the relieving factors. You're knowing sunlight, temperature, occupation, like that. Previous general medical surgical problems, previous history of eczema and psoriasis, and common any problem, atopic eczema, psoriasis, ichthyosis, to any of the relatives, first degree relatives, basically. Okay, you want to check all these questions. And inspection of the skin. You want to check all the skin. So, my task two, okay, please check your body today itself. You can see a number of skin lesions in your body. Please take a photo. Photo is not necessary. Please write it. I am having a wheel. I will check, tell all these things. Okay. Please check it. Color shade, scars, birthmarks. I think almost all of you are having scars. Birthmark, tattoo. Okay. Psychological, physiological conditions and other problems like lumps or flaking. Clear? And the color of the skin, whether cyanosis, redness, allergy, bleeding tendency like petechiae. I will show the photos. Pallor, okay, abnormal yellow color, pigmentation, vitiligo. Vitiligo will be seen in hyperthyroidism also, anemia also, hyperpigmentation in fungal infection, port wine stain in vascular birthmarks, bronzing of skin in Addison's disease. You want to check all these things, okay, whenever you are examining a skin patient. Hyperpigmentation due to sunburn. Okay, I will share this PPT. I'm just moving forward. Clear or not? I will show the photos. Okay, you are knowing that cyanosis. How many of you are checking? How many of you are seen? Redness. Okay. In Indians, it is not so common, but okay. Petechiae. You are knowing that this is petechiae like purpura. Small bleedings. Okay. Pallor. Okay, I'm giving a photo. Whitish. Okay, color. Then jaundice. How many of you had identified jaundice of a patient? How many of you are identified? There are so many cases coming to your OPD. How many of you are identified? Yes, good, good. Okay, the next case, what is this? Right side. What is the disease? You're getting an idea, I think. Vitiligo. So all these are skin conditions itself. Okay, cyanosis, redness, petechiae, pallor, jaundice, vitiligo, and I'm explaining in which conditions it is happening. Okay, port wine stain, hyperpigmentation and hypo and hyper. You are knowing albinism, in which hypopigmentation is there, and hyperpigmentation is there is also in some sun atopic dermatitis or like that. Okay, port wine stain. Okay, in which disease? Vascular birthmarks. Okay. Then bronzing of skin. I have explained bronzing of skin is seen in Addison's disease